Now the debate over the U.S. healthcare system and how it compares to Canada's. Americans have been known to head north of the border for cheap medicines, but it turns out some Canadians are coming to the United States to get medical treatment. Dan Springer is live from Vancouver, British Columbia tonight. Dan, why is it, actually I should say, why come to the United States if there's already free health care from the Canadian government, if even in the rain?
Well, yeah, bottom line, Shep, if you can't get access to it, doesn't matter if it is free. We heard some compelling stories today from Canadians, from the 2-year-old boy who couldn't get access to an MRI, who had seizures, to a woman who was told she was too overweight to have a hip replacement surgery. And then there's Lindsay McCreath from Toronto, who was diagnosed with a golf ball-sized tumor on his brain. After getting that MRI in the United States, he was told by his Canadian doctor it would be 4 months before he would have access to a specialist. He decided that was too long, so he came to the U.S. to Buffalo to have that life-saving operation. And then Lynn Gilbert from Vancouver was diagnosed with a rare spinal condition. She said she was in excruciating pain. It took a year to diagnose because of the lack of diagnostic testing here, and 2 years on a waiting list for spinal fusion operation. She said the wait was absolute hell.
I lost feeling in parts of my feet. I also lost control of my bladder. So basically I was 29 years old, 2 kids, wearing diapers, using a walker, and loaded on morphine.
There are some people who go to the U.S. for care, but no, it has nothing to do with our Medicare system, and there aren't very many of them that do go to the U.S.
Now, critics of the single-payer, government-run system here in Canada say it works really well if you don't get too sick. If you have to have an operation, be prepared to wait. Shep?
Of course, you wonder if it's really a fair comparison. No one is introduced a single-payer system here. In fact, a government-run option, it has barely been suggested, at least isn't included at the moment. We'd still have private health insurance here, so, I mean, it's different.
Well, but some people in the United States would like to see some sort of a public option, which many believe could lead to a single-payer system if the government-run option was to take over. I mean, there's always that possibility that you can't compete as a private insurance company with the deep pockets of the government.
Of course, the government says they compete with FedEx and they compete with UPS, and you have options, and that's what they're suggesting here. So we'll see how it goes. Nothing on the table yet.